This video is covering Chapter 19 of Anatomy and Physiology, blood vessels. If we follow the blood through the heart, the arteries then carry the blood away from the heart, which go into arterioles, which bring the blood into capillary beds. The capillary beds then bring blood to the venules, which bring it back to the veins, which go back to the heart. There are three wall layers of the blood vessels: the tunica externa, the tunica media, and the tunica intima. The tunica externa, or adventitia, is the outermost layer. The tunica media is the middle layer, which consists of smooth muscle and elastin. And then the tunica intima is the innermost layer and consists of simple squamous epithelia. And its purpose is to smooth out blood flow. There are three types of arteries: elastic, muscular, and arterioles. Elastic arteries are also known as conducting arteries because their large lumen make them low resistance pathways that conduct blood from the heart to medium-sized arteries. They contain more elastin than any other type of vessel and are closest to the heart. For example, the aorta is an elastic artery. Muscular arteries, also known as distributing arteries, are medium-sized that deliver blood to specific body parts. They have the thickest tunica media of all the blood vessels, as you can see on the picture. Arterioles are small diameter blood vessels that control blood flow into capillary beds. There are three types of capillaries as well: continuous, fenestrated, and sinusoidal. Continuous capillaries, which are the most common, have lots of tight junctions, making them not leaky. They also have intercellular clefts, which are cracks in between cells that let fluid leak out. Fenestrated are capillaries that have fenestrations, which are holes that let solute pass in and out. They are more leaky than continuous, and they are located in the SI and kidneys. Sinusoidal have fewer tight junctions and fenestrations, and they have larger intercellular clefts, making them extremely leaky. They are located in the bone marrow and spleen. The venous system. In the venous system, there are venules and veins. Venules collect blood from capillary beds, and there are also postcapillary venules, which are right after capillary beds. Veins are also in the venous system and return blood to the heart, and they have much thinner walls than capillaries. Blood flow, blood pressure, and resistance. Blood flow is how much blood passes through a certain area and is measured in milliliters per minute. Blood pressure is the pressure of circulating blood pushing on the walls of blood vessels and is measured in millimeters of mercury. Peripheral resistance is the friction encountered by blood in vessels, and it slows down the flow of blood. There are three important factors affecting peripheral resistance: blood viscosity, blood vessel diameter, and total blood vessel length. With blood viscosity, it's the thickness of blood, and an increase in blood viscosity increases peripheral resistance. Blood vessel diameter, vasoconstriction increases peripheral resistance, and vasodilation decreases peripheral resistance. And total blood vessel length just means the longer the blood vessel, the more peripheral resistance there is. Systemic blood pressure. Arterial blood pressure is the average pressure in a person's arteries during one cardiac cycle. There are a few definitions you'll need to know: systolic pressure, which is the peak pressure; diastolic pressure, which is the lowest pressure in the aorta; pulse pressure, which is the difference between the diastolic and the systolic; and the mean arterial pressure, which is diastolic pressure plus pulse pressure divided by 3, which is also known as the average arterial pressure. As we continue with systemic blood pressure, there is also capillary blood pressure and venous blood pressure. With the capillaries, it is low, usually between 40 to 20 millimeters of mercury, and with the veins, it is very low, around 15 millimeters of mercury. It's steady and changes very little during cardiac cycle. Since the pressure is so low, there are a few factors aiding venous return. There are valves, which are structures that make blood flow in one direction, respiratory pumps, which move blood up towards the heart as pressure changes in the ventral body cavity during breathing, and muscular pumps. As skeletal muscles surrounding veins contract and relax, they make blood move toward the heart. There are several factors affecting blood pressure which are very important and you will need to know. There's cardiac output, which is how much blood your heart is pumping, and an increase in cardiac output increases blood pressure. There's peripheral resistance, and an increase in peripheral resistance equals an increase in blood pressure as well. And blood volume, which is pretty clear, more blood equals an increase in blood volume. And you can go by this formula if you need help. When dealing with blood pressure, there are short-term and long-term mechanisms. There are neural controls, which their goal is to keep blood pressure consistent. There are vasomotor centers, which control blood vessel diameter, baroreceptor-initiated reflexes, which measure pressure, and if they detect a pressure increase, they cause vasodilation, which will lower blood pressure, and if they detect pressure drop, they'll vasoconstrict, increasing blood pressure. There are also chemoreceptor-initiated reflexes, which increase blood pressure and cardiac output. So if O2 levels drop or CO2 levels go up, it causes an increase in heart rate and an increase in blood pressure as well. And lastly, there are higher brain centers like the medulla and hypothalamus. There are chemical controls as well for short-term mechanisms. There are adrenal medulla hormones, epinephrine and norepinephrine. Epinephrine is good at vasoconstriction, while norepinephrine is good at increasing cardiac output. There's atrial natriuretic factor, which is a hormone produced in the atria of the heart. It decreases blood volume, therefore decreasing blood pressure. There's antidiuretic hormone as well, which reduces reabsorption of water in the kidneys. Angiotensin II is also part of chemical controls. It is part of the renin-angiotensin loop, which causes vasoconstriction, increases blood pressure, and causes the adrenal cortex to release aldosterone. The endothelium-derived factors are also here, which release endothelin, which cause vasoconstriction, and nitric oxide, which causes local vasodilation. There are two more chemical controls: inflammatory chemicals and alcohol. For inflammatory chemicals, some examples are histamine and kinins. They increase vascular permeability, lower blood pressure, and are known as vasodilators. For alcohol, it is also a vasodilator, causing blood pressure to drop and inhibits ADH. Renal regulation is a long-term mechanism, and there are direct effects and indirect effects. For direct effects, it is via changing the blood volume. So if blood pressure increases, then urine production increases. If blood pressure decreases, then so does urine production. There are indirect effects, which is the renin-angiotensin mechanism. A decrease in mean arterial pressure causes kidneys to secrete renin, and renin causes production of angiotensin II, which causes vasoconstriction, which then causes an increase in blood pressure, which then causes kidneys to reabsorb sodium, and of course, water follows sodium in the body, and a decrease in urine production and increase in blood volume is the end result. There are a couple alterations in blood pressure that you need to watch out for. There's hypertension and hypotension. Hypertension is a blood pressure of 140/190 or above. There's essential hypertension, which has no underlying causes and can't be cured, but it can be controlled. There's also secondary hypertension, which is caused by endocrine disorders, and treatment focuses on correcting the problem that caused it. Hypotension is low blood pressure, and there's orthostatic, chronic, and acute. Orthostatic is temporary drop in blood pressure resulting in dizziness and is common especially in the elderly. There's chronic, which can occur in malnourished people, and acute, which is an important sign of circulatory shock. Tissue perfusion is blood flow through the body tissues. There are a few general purposes which you'll need to know just as an overview. It delivers oxygen and nutrients, removes wastes, gas exchange in the lungs, forms urine in kidneys, and absorbs nutrients in the GI tract. The velocity of blood flow is inversely related to cross-sectional area of a blood vessel. So the more area a blood vessel is, the slower it is. And there are also local regulations of blood flow, which control the flow coming into organs and tissues. There are metabolic controls, which lack of oxygen is the strongest stimuli to increase blood flow to an area, and myogenic controls, which deal with smooth muscle working in opposite direction of stimulus, and the long-term autoregulation as well, when the body will just make new blood vessels. It is also very important to know the blood flow in special areas. For skeletal muscles, there's exercise hyperemia, which increases blood flow to muscles with increased activity. So when you exercise, blood rushes to the areas where muscles are the most active. For the brain, it's all controlled by pH, and low pH causes high CO2 levels, causing vasodilation, which increases blood flow. And for the skin, their nutrients and waste exchanges regulates body temperature and provides a blood reservoir. So if you start to lose blood, your capillary beds will start to close down and divert your blood into your internal organs. The lungs have low pressure compared to the systemic system, and autoregulatory mechanism is opposite to that in systemic. Dropping oxygen levels will raise vasoconstriction in the lungs, and high oxygen levels will raise vasodilation. And for the heart, there's coronary circulation. The aorta provides pressure to push blood for coronary circulation. And for myoglobin, they hold on to oxygen for when the heart is in systole. Blood flow through capillaries. Capillary exchanges of respiratory gases and nutrients. Diffusion is substances moving from high concentration to low concentration, and oxygen and carbon dioxide use diffusion to travel from blood to tissue. Active transport is the opposite and needs ATP to work. Hormones transport oxygen actively from low to high concentrations. For fluid movements, there's hydrostatic pressure, which is the pressure against the wall of a blood vessel. There's capillary hydrostatic pressure, which is the force exerted by blood pressure, also known as filtration pressure. There's also interstitial fluid hydrostatic pressure, which acts outside the capillaries and pushes fluid inwards. There's osmotic pressure, which is pressure caused by a dissolved solute, and hydrostatic osmotic pressure interactions occur when the net hydrostatic pressure is greater than the net osmotic pressure. It causes the fluid to move out of the capillaries. When net hydrostatic pressure is less than net osmotic pressure, fluid moves into the capillaries. Our last slide talks about the clinical problems you would see dealing with the blood vessels, which is circulatory shock. Circulatory shock is when there's inadequate blood flow for tissue needs. Hypovolemic shock is when there's not enough blood to make enough pressure to move the fluid, and vascular shock is when blood vessels stop constricting. Thank you so much for listening. I hope this video helped you, and good luck with all your anatomy and physiology endeavors.